Well, the title of this video is obviously in jest, but it does make a point as to why I have been doing all these videos and this channel and all this content around pain science education, and how this has informed my thought over the last few years from writing a book on pain management to where I am now, a trauma-informed upstreamist and a lifestyle medicine physician. And I think it's very important for me to kind of bring this out to all of you, to actually say why I'm doing this and why I have kind of changed talking about just pain medicine to thinking about lifestyle medicine as a bigger umbrella in which to offer chronic pain management. I've trained in different countries. I've done my undergraduation in India, my post-graduation in India in the field of anesthesia and pain medicine, and I've come here at the turn of the century here, and I've been in the UK for the last 20 years. And the understanding of pain science and the neuroscience behind how we look at pain and how we are thinking about this very complex emotion and sensation is completely turned upside down. None of what we studied in medical school is really valid anymore in terms of how we approach this particular problem. This particular issue of chronic pain is becoming a major worldwide issue. Back pain, for example, is the biggest cause of disability and economic productivity loss in the whole world. There's literature and evidence, so much so that 1.5 to 2 billion of the world's population are struggling with back pain, and every developed and developing country cites back pain and indeed chronic pain as affecting almost 20% of their population. So this is a problem that's really growing despite all attempts to reduce it using medications or injections. So we know the established treatments are not working, and we don't seem to really have a handle on what to fund and what new treatments to go for. In the last 5 to 8 years, I've realized that to manage pain, we need to understand the ecosystem and the habitat from which our patient comes. As the Welsh word goes, Cynefin, this is so important in then deciding what the treatment plan for a person's pain is going to be. And that means understanding what the social determinants of health are, and then bringing in a variety of other neuroscientifically evidence-based approaches to calm the nervous and immune system down, and finally bringing in a whole team of multidisciplinary and interdisciplinary professionals to support the patient, not just in the specialist care, but also in the community, to provide a wraparound service. And that is where the best advances and the best solutions have come in overcoming pain. Indeed, by listening to and looking at and learning about patients who have become pain-free, I've realized that getting these three fundamental pillars of understanding who they are, of the set of lifestyle-based approaches they need to take, and finally having principles of behavior change and reinforcing new habits and retraining the system, that's what makes the difference. And that is why moving upstream, working in primary care, establishing and mapping the community assets, and creating a whole lifestyle medicine-based integrative approach is the way forward. And that, I think, is very important for most healthcare professionals to do with long-term conditions. And that's why I have chosen to do that as a pain doctor practicing lifestyle medicine for my patients with chronic pain. I hope you found that video a little bit useful and illuminating about why I think this is the right way forward, and I look forward to seeing you in my next video. Thank you for watching. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.